serve as an associate director in the Office of Public Engagement, formerly the Office of Public Liaison. For 40 years, that was our name. And so most of the time I do operate in the background. I'm not trying to be in the picture. I'm not trying to be at the press conference. My job and the job of the office is to make sure that you're plugged in to policy discussions, meeting with senior advisors or folks in the administration, whether they're in the White House or across the government, as much as you need to be plugged in. As you can tell, there's so many folks in our community that are kept out of having influence on policy because they just don't know how the federal government operates. They don't understand the bureaucracy. And there are so many folks who do, but they're not rushing to explain it to you. So that's the long and short of why I have a job. And my job as the religious liaison is to make sure that faith communities of all colors, all denominations, all persuasions are having influence, injecting that voice of morality into the policy discussions that it's so easy to forget about the moral dimension too many times. And just before I say anything else, I would like to say thank you for the work that you're doing. I've seen what what your organization has been doing under Dr. Butts and Dr. Fields' leadership. I know the influence that you're having inside the White House. We just had a meeting on this issue, just staff together last Friday. And it's hard to have a conversation about what we're doing on HIV/AIDS without talking about what you're doing to combat HIV/AIDS. Intimately related to that is the conversation on health insurance reform. And you know, as you've heard from folks older and wiser than myself, how close we are and how difficult it is on this bill this week. Just yesterday evening, we announced that the president was going to George Mason University this Friday at 11 a.m. And going into the weekend, that is going to be sort of the last major address that the president's going to give on this issue. And this is specifically to our D.C. pastors that are in the room this morning, but open to all of you. We need your help to make sure that, it's good to fill the seats with, students and other folks that have something to say about this. But it's critical to fill some of those seats with faith leaders, with pastors, with women auxiliary groups, anyone from the church, so that you're a part of this, what we expect to be a historic event going into the vote this weekend. Again, it's at George Mason University. Doors open at 9 a.m. The program begins at 11. But we want to mobilize as many people, and I'm glad to be here this morning. And thank you, Linda, for letting me know about the opportunity here, because your mission is, to educate, to organize, and to mobilize. And that third piece is one I want to work with you on over the next couple of days to make sure that we're mobilizing people of faith to get over to the Patriot Center at George Mason and stand with us going into the weekend. And I see Reverend Warnock in the back, and I just want to salute him. I saw him. It was a group of about 10 of us at the White House watching MSNBC earlier in the week as he was talking about this critical issue and calling out the what he called the unholy trinity: silence, stigma and shame. And we're continuing to work on this specific part of keeping our people healthy. But this weekend, we're focusing on the larger picture, making sure that millions and millions more Americans have the care that they need, the care that we can afford if we only would have the will and the courage to stand up and demand it. So thank you very much for your time. I appreciate you having me. God bless you.